Okay guys, we'll start with this psychiatry part of our game changer session. The first thing you need to know is about this antipsychotic drugs. This antipsychotic drugs, if you see, it is integrated with both pharmacology and psychiatry. Okay, तो मैं both in and out आपको जानना चाहिए, ठीक है? Rest psychiatry तो वैसे वैसे easy peasy है, ठीक है? So if you see about this antipsychotic drugs, like this antipsychotic drugs, हमें पता है the psychotic it is due to this increased level of dopamine, ठीक है? तो here हमें डोपामिन को ब्लॉक करना और डोपामिन को हमें कम करना, ठीक है? डोपामिन को हमें कम करना. So this is the usual thing of this what this typical antipsychotic drugs do. Okay, the typical antipsychotics यही करता है, लेकिन this antipsychotics it may cause few side effects and it can be associated with this other serotonin features as well. ठीक है, तो उसी वक्त हम क्या करेंगे, हम atypical, now we started using this atypical antipsychotics because of this typical psychotics का side effects की वजह से. So what are the typical side effects or typical antipsychotic drugs? This includes our D2 blockers. Okay, dopamine receptor D2 blockers, which is this haloperidol, and weak D2 blockers, which is this chlorpromazine. So two drugs, haloperidol, chlorpromazine. ये दोनों तो आपको याद रखना ही रखना, ठीक है? पर जो भी बाकी जो भी पढ़ेंगे, it will be come under this atypical side effect. Yeah, clozapine, olanzapine, ziprasidone, ये सारे हम पढ़ेंगे, ठीक है? रुक जाओ, ठीक है? Then about what is the side effect, ठीक है? इसको हमने ज्यादा यूज नहीं करते हैं क्योंकि इसका साइड इफेक्ट है. क्या क्या साइड इफेक्ट हो सकता है, ठीक है? फर्स्ट द मोस्ट कॉमन साइड इफेक्ट इट इज द akathisia, ठीक है? There will be people, right, like they'll be shaking, like they'll be always restless, ठीक है? They'll be always restless. So this kind of restless feature after taking this kind of drug, it is what it is, this after taking this kind of typical antipsychotic drugs, it is known as akathisia. It is the inner sense of restless. It is tremors, like it's not exactly tremors, like they will feel like kuch ho raha hai, ठीक है? They will feel restless, they won't sit in a small place, in a single place they won't sit, like जैसे हाथ कांप रहा है तो वैसे they will be having this inner sense of restlessness, ठीक है? It is known as akathisia. और इसको ट्रीट करने के लिए हम क्या करेंगे, प्रोप्रानॉल देंगे. इसको ट्रीट करने के लिए हम प्रोप्रानॉल देंगे, ठीक है? Then because of this antipsychotic drugs it can go on decrease the acetylcholine, okay, and it means and it also go on decrease. हम डोपामिन को ब्लॉक कर रहे हैं, अगर डोपामिन ज्यादा हो गया तो it leads to psychosis. अगर डोपामिन कम हो गया it will cause Parkinsonism and it is known as drug induced Parkinsonism. And in a case of drug induced Parkinsonism हम क्या देंगे, हम acetylcholine मतलब हम parasympathetic drugs देंगे. Example benzoxal, especially the benzoxal bipyridine, which also known as was trihexyphenidyl, which is the benzoxal. Remember it is benzoxal will use in a case of dystonias and Parkinsonism. Okay, dystonias and Parkinsonism के लिए हम benzoxal देंगे, ठीक है? Then about this tardive dyskinesia, there will be this odd facial expressions or there will be this sounds and tics will be produced, and for them we'll use this valbenazine. Okay, so tardive dyskinesia के लिए हम क्या करेंगे, the same TV, it is the valbenazine will use. Then there is one more syndrome. After using the drugs, the patient will be started having this fever. There will be a fever will be there, and there will be this elevated liver enzymes, okay, and elevated neutrophil count, and along with this CPK counts will be elevated. So all of this thing will be suggesting of a condition which is known as neuroleptic malignant syndrome. और उसको ट्रीट करने के लिए हम क्या देंगे, dantrolene देंगे. So neuroleptic malignant syndrome के लिए हम dantrolene देंगे, akathisia के लिए propranolol देंगे, पार्किंसनिज्म के लिए हम बेंजोहेक्सोल देंगे, ठीक है? और टार्डिव डिस्काइनेसिया और डिस्टोनिया के लिए हम यूजुअली क्या देंगे, बेंजोहेक्सोल देंगे, ठीक है? नेक्स्ट अबाउट द नेक्स्ट ड्रग व्हिच इज दिस टिपिकल एंटीसाइकोटिक्स. ओके, टिपिकल एंटीसाइकोटिक्स क्या करेगा, इट आल्सो विल गो ऑन ब्लॉक दिस डोपामिन रिसेप्टर्स और इट विल टेक केयर ऑफ दिस अदर रिसेप्टर्स एज वेल. तो क्या क्या है, यू कैन रेफर दिस रोज PQ और रोज और Q. ओके, पास क्लोजपिन, like risperidone, olanzapine, ziprasidone, and clozapine and aripiprazole. Rosca, or else you can remember. Okay, please forget what is this exact one. So remember, it is this Rosca. It is what? It is this. Yeah, Cosra. Yeah, good, Dr. Hans. It is what? It is the Cos RAQ. Yeah, it is the Cos RAQ. Okay, it is Cos. Thank you. This goes on. So see, this it is what it is, this olanzapine, clozapine, olanzapine, then ziprasidone, clozapine, olanzapine. Yeah, clozapine is an atypical one. So now we are discussing about the atypical, ठीक है? तो typical one it will just go and block this dopamine receptor, तो इसीलिए इतने सारा side effects है. तो now हम क्या करेंगे, तो dopamine को भी block करेंगे, फिर उसके साथ साथ जो भी extra added है उसको भी हम block करेंगे, ठीक है? इतना याद रखो, ठीक है. So here it will be clozapine, olanzapine, zipraspiridone, risperidone, aripiprazole and quetiapine. Aripiprazole and quetiapine. So these are the drugs which will be classified as typical antipsychotics. और typical antipsychotics के भी side effects होते हैं, लेकिन it will be of other system side effects like systemic side effects, like there is elevated level of sugar, hyperglycemia होगा, there will be increased weight causing this obesity, and there will be sedation. So sedation, weight increase, and there will be increased sugar, which is hyperglycemia. ठीक है. And the next one, it is this clozapine. It is a drug of choice for this treatment resistant schizophrenia. I'll tell you what is this treatment resistant schizophrenia. आप बस इतना याद रखो, treatment resistant schizophrenia और schizophrenia with suicide tendency, ये सब के लिए हम क्या देंगे? clozapine देंगे. हम clozapine देंगे. And remember, and this causes this maximum weight gain. It causes the maximum weight gain. ठीक है. और इसमें ये क्या क्या कर सकता है ना, ये दिल को और दिमाग को, ठीक है. It will affect both heart and the CNS. So that's why it will cause myocarditis, ठीक है, and seizures. Myocarditis and seizures will be caused by this clozapine, and it will cause one more thing which is known as what? Agranulocytosis. Okay, it will increase, this means it will decrease the level of this, especially this granulocytes, like okay, neutrophils. Okay, agranulocytosis, which is one of the most dangerous complication. ठीक है. और जो भी इसके साथ साथ जो agranulocytosis करता है, उस ड्रग्स को इसके साथ हम नहीं देंगे. ठीक है. तो दिस इज द टिपिकल एंड एटिपिकल वन. एटिपिकल में तुम्हें बस ड्रग्स याद रखना, which is cause rock, which is this clozapine, olanzapine, ziprasidone, and risperidone, aripiprazole, and quetiapine. Okay, then the side effects which include दिमाग को और दिल को. Okay, it is what it is, this seizures and myocarditis, and along with this blood, which is this agranulocytosis, and it will cause this maximum weight gain. Fine. So remember all these points. फिर उसके बाद आते हैं डिप्रेशन का ड्रग्स. ठीक है, जो हमें अभी जरूरत है. ठीक है. So see if about this drugs of the depression, which includes this SSRI, TCA, and SCRI. See this typical matlab we usually used to use previous times. Now we have this reduced their use. The typical, which includes this MAO inhibitors, which is this moclobemide. Okay, MAO inhibitor, which is moclobemide. बस इतना याद रखो. Next one, we used to use before the TCA, but we are reducing this use because of its side effect. TCA matlab tricyclic antidepressants. Okay, it will act on these three receptors. Fine. And it include imipramine, desipramine, desi, and ami. Desi, ami, and nortriptamine. Okay, imipramine, desipramine, and amitriptyline, and nortriptyline. Imi is a desi. Okay, imipramine, desipramine, amitriptyline, and nortriptyline. And what are the side effects? The side effects which include, if it blocks this acetylcholine receptors, it will result into this dry mouth, like datura में dry mouth, blood visions, and it is contraindicated in the case of glaucoma. ठीक है, तो इसीलिए it is contraindicated in the case of glaucoma में. ठीक है, and it can lead to this posterior hypotension and sedation. And the most lethal वाला क्या हो सकता है ना, it can cause this heart involvement, causing arrhythmias, and the major thing which is this मेटाबॉलिक एसिडोसिस. ये क्या करा सकता है? मेटाबॉलिक एसिडोसिस. तो इसीलिए टू ट्रीट दिस टीजीए टॉक्सिसिटी विल यूज सोडियम बाइकार्बोनेट. There will be a history. There is a patient who is presenting with features of depression. As a psychiatrist, you started with a TCA drug, and now the patient is presenting with metabolic acidosis. What is the next line of management you will give? You will give this sodium bicarbonate. ठीक है, सोडियम बाइकार्बोनेट. ठीक है, इतना याद रखो. You will give sodium bicarbonate to correct this metabolic acidosis part. फिर उसके बाद है SNRI, सेलेक्टिव नॉरएड्रेनालिन रीअपटेक इनहिबिटर्स. ठीक है, ये नॉरएड्रेनालिन को रीअपटेक करने में इनहिबिट करता है, तो इसीलिए उसमें नॉरएड्रेनालिन का लेवल और सेरोटोनिन का लेवल दोनों बढ़ जाता है. ठीक है, दोनों बढ़ जाते हैं. ठीक है, तो इट इज द ड्रग ऑफ चॉइस फॉर सीवियर डिप्रेशन. इट इज द ड्रग ऑफ चॉइस फॉर सीवियर डिप्रेशन. वरस यूजुअल के लिए हम SSRI यूज करेंगे, वो हम देखेंगे. ठीक है, वरस फॉर सीवियर डिप्रेशन इट इज दिस SNRI. It is the severe depression, which includes mainly venlafaxine, duloxetine, and desvenlafaxine. These are the three drugs which are come under this SNRI, which used for the severe depression. ठीक है, फिर इसके बाद आगे बढ़ते हैं SSRI. So all the cases of this selective serotonin reuptake inhibitors will use these drugs, like all the cases of this depression and few other conditions will use this SSRI. So this includes fluoxetine, fluoxamine, and citalopram. Okay, fluoxetine, fluoxamine, and citalopram. Fine. And this this drug will be having this sexual side effect. So because of having the sexual side effect, okay, will use for this sexual treatment. For example, if there is premature ejaculation, this drug what will do this as a sexual side effect in females, it will decrease the libido part. It will decrease the libido part, and males it will delay the ejaculation. So we'll use them as a treatment for delayed ejaculation. So SSRI maybe will use especially this depoxetine. Okay, depoxetine is used for delaying the ejaculation. Delaying the ejaculation. Okay, remember depoxetine delays ejaculation, तो इसीलिए इसको हम premature ejaculation में use करेंगे, ठीक है. And SSRI I told it is the drug of choice for this most of the depression which includes this mild and moderate, ठीक है. Severe के लिए हम SNRI use करेंगे like venlafaxine, okay. And SSRI it is also drug of choice for this generalized anxiety, OCD, bulimias, phobias, PTSD and impulse control disorder, ठीक है. And it causes delayed ejaculation, तो इसीलिए हम depoxetine को हम premature ejaculation के लिए use करेंगे, ठीक है. And it can lead to this syndrome which is known as discontinuation syndrome, ठीक है. जैसे आप SSRI लेना छोड़ दोगे, you will be able to this discontinuation syndrome which will be having this flu-like illness, ठीक है. जैसे nasal stuffiness हो जाएगा, ऐसे होगा, ठीक है. It is known as discontinuation syndrome, ठीक है. And there are few more atypical antidepressants which include bupropion, ठीक है. You know this mnemonic like bupropion and sutopion. Okay, so this bupropion is used as an anti-smoking drugs, and then amitriptyline it inhibits reuptake of 5-hydroxytryptamine, the same with trinipant. So remember in this, remember mainly about this bupropion and vortioxetine. Okay, these two drugs. And in the case of severe depression, which is resistant to these drugs, then we can try with this ketamine. Okay, our anesthesia ketamine is as a nasal spray, which is known as ketamine. That is used as a nasal spray. Fine. And this brexanolone, which is used as a postpartum depression. Okay, postpartum depression में हम brexanolone देते हैं. Brexanolone हम देंगे. ठीक है, इतना याद रखो. Then about this schizophrenia component. Fine. Okay, schizophrenia. If you see about the schizophrenia, we need to know there are different types of schizophrenia. Mostly what they will give this diagnosis. Like they will ask you to diagnose this schizophrenia component. How will you diagnose? See, there will be what? There will be telling there is a patient who is having these features of hallucination. Okay, he's seeing new things. He's able to see, able to hear sounds, auditory hallucinations. Okay, and his personality is well preserved. Okay, his personality is well preserved, and yeah, the criteria is more than 6 months. It should be present. Okay, his personality is well preserved, along with this strong belief that Russian agency is spying on him or this Chinese agency is spying on him, and he's having this presentation of hallucinations. So all of this thing will be typical for this type of schizophrenia, which is known as paranoid type. Means paranoid means personality will be preserved. Whereas in the case of catatonic, if you see, catatonic will be having this motor movements, like this waxy flexibility and catalepsy. Waxy flexibility, catalepsy, all of these things, they are the motor features, are grimacing, odd movements, it is known as grimacing. These are these features which is seen in a case of catatonic schizophrenia, and it will be have the best prognosis. ठीक है, अगर किसी को कैटाफ्रीनिया बहुत बढ़िया, ठीक है ना, उसको best prognosis से treated. Next one, it is known as hebephrenic schizophrenia. Hebephrenic will be having this negative symptoms, and there will be severe deterioration of this personality along with the bad habits. Okay, remember hebephrenic, it is the severe deterioration, okay, with bad prognosis, and personality will not be maintained. Okay, बहुत गंदा. Okay, hebephrenic, it is the ganda one, and it will be having this ganda prognosis. Remember, and next it is the residual one. Okay, from an early stage of depression to this latest stage with more negative. मतलब yearly में जो भी positive symptoms, for example hallucination हो गया, delusion हो गया, वो yearly मतलब पहले बहुत अच्छा, जैसे in every part of relationship everything looks very much beautiful. ठीक है, तुम हंस रहे हो, बहुत अच्छा लग रहा है, ठीक है ना, तो then तुम रो रही हो, मतलब ये भी बहुत अच्छा लग रहा है. Then later on you will feel the change. So the initial part you will able to see the in yearly phase there will be more type of positive symptoms like delusion and hallucination, and then in later part you will able to see this alexithymia, okay, evaluation. So all of these negative symptoms to be coming up. Okay, so it is known as residual schizophrenia. Okay, and finally this one is a simple schizophrenia which happens with mostly of negative symptoms. It looks simple, but it is very complex because of its negative symptoms. Okay, remember. Okay, and it has the worst prognosis. So hebephrenic it will be having this bad personality but bad prognosis. Whereas worst will be what will be the simplest guys are the worst guys. Okay, and next this schizophrenia, once you treat, you think the patient is recovering, but at certain point of time while recovering itself, what will happen? There will be an increased risk of suicide. Okay, the patient will be good till yesterday. Once you discharge him, he will go and jump from the 5th floor and he will die. Okay, so this type of suicides will be associated with this post schizophrenic depression. Okay, and there are few other types of schizophrenia which include prof schizophrenia, which is seen in a case of mental retardation along with schizophrenia. So prof which is schizophrenia with mental retardation, and von Gogh schizophrenia which is presenting with this self mutilation, like Lee-Schnahan syndrome. We'll be able to see this self mutilation. Likewise, the von Gogh, there will be schizophrenia patient, he'll be eating his nail, eating his finger, eating his ear. Okay, so this is this von Gogh syndrome. Whereas Onirad means it is a dream-like state. So this is a dream-like schizophrenia. That is GPRTS deficiency. Yeah, in adolescent age, there will be, you will be able to see one more thing which is known as copycat suicide. Good guys. Then what are the symptoms you will tell that he is having schizophrenia? So Schneider proposed this 11 first rank symptoms. This include 3 thought phenomena. Someone is inserting thought, or someone is taking how to start, or someone is broadcasting. ठीक है, वो सोच रहा है कि अभी noodles बनाऊंगा. So someone is broadcasting, there is a noodles making video. So it is what? It is 3 thought insertion, thought withdrawal, and thought broadcast. And made phenomena. He made to do it. Okay, your father made to study MBBS. Okay, this is the made phenomena. And made effect. He made to change my mood. Okay, and he made to make this impulsive act. Fine. And 3 audible hallucinations. The two voices first they will argue and they will give running commentary. ठीक है, वो अभी गेम चेंजर सेशन देख रहा है, फिर इसके बाद अभी चाय पीने जाएगा. ठीक है, फिर उसके बाद वो दोबारा गेम चेंजर सेशन देखेगा, फिर शाम को आकर रिवीजन करेगा, फिर PAQ करेगा, फिर एग्जाम में पास होगा. तो दिस विल बी द वॉइस विल बी गिविंग दिस रनिंग कमेंट्री. ठीक है, दैट्स ऑडिबल थॉट्स. अभी मैं पढ़ रहा हूँ. ठीक है, मींस अभी मैं पढ़ रहा हूँ, तो वट एवर थॉट्स यू आर थिंकिंग, it is audible to you. It is known as audible thoughts. So what are the 3 auditory hallucinations? The voice will be arguing. ठीक है, वो ये सेशन देख रहा है, वो बढ़िया पढ़ रहा है, अच्छा पढ़ रहा है, तो 2 of them they will be arguing. ठीक है, and the voice giving running commentary as what you are doing. Okay, yeah, like it is this simple explanation, nothing. Like auditory hallucinations, what you will do, initially will talk, like 2 voices will be talking about you, like you are studying well, yeah, wow, how he is studying, see how he is changing the page, how she is looking beautiful today. Likewise, 2 people will be arguing, like arguing. It is known as what? It is known as auditory hallucinations. The one part. Second part, they will give you running commentary. Okay, she is watching this series, Gamechanger series. She will be doing a questions. She will be passing the examination. Likewise. Then about the third one, it is audible thought. Like whatever thought you think, it will be audible to you. So these are the 3 auditory hallucinations. Okay, paravala, sorry. Fine. Then next, there will be this 2 more things which is known as somatic passivity and delusional perception. Somatic passivity and delusional perception. Like when you see this phone, you remember that you are having a test. So likewise, you will be having delusion which is associated with this perception. Okay, fine. Next, about this treatment of this schizophrenia. Schizophrenia का usually हम treatment कैसे करते हैं? देखो, means in the case of treating schizophrenia, we will start with atypical antipsychotics. देखे थे ट्रास्क्यू, like clozapine, except clozapine, olanzapine. ठीक है, except clozapine, olanzapine, तो risperidone है, ziprasidone है. We'll start with them. Then after 6 weeks हम देखेंगे. Means after 6 weeks we'll check whether this drug is working for him or not. Okay. फिर उसके बाद हम क्या करेंगे? अगर if it is not working, then we'll change to another atypical antipsychotics. ठीक है ना? We have this rescue drugs, except 2 drugs, we have more 4 drugs. So we'll change them. So we'll see for more 16 weeks. So after see, this is the 6 weeks. After 6 weeks, if after 12 weeks itself, if it is not resolving, then we'll change them into this typical antipsychotics, which include haloperidol or flurperazine. Okay, we'll change them into a typical antipsychotics. Then we'll see for 6 more months. If nothing works, then we'll change into clozapine. So if it is resistant to this 3, means these 3 steps of treatment, which is the 3 drugs, like 2 types of atypical drugs and 1 type of typical antipsychotic drugs. Okay, for this 18 weeks, अब हम बोलेंगे it is known as resistant schizophrenia, or in a case of resistant schizophrenia, we'll treat them with clozapine. And in a case of clozapine resistant schizophrenia, हम ECT देंगे, means हम shock देंगे. ठीक है, shock देंगे. ठीक है, इतना याद रखो. Then about this drug, which is the lithium. Okay, this is the lithium. See, About this lithium, if you see the half-life of lithium, it is what? It is this around 24 hours, about 24 hours. Okay, the half-life of lithium is 24 hours. Okay, and sometimes this lithium may cause toxicity, and the toxicity usually comes with nausea, vomiting, sometimes associated with diarrhea, then ataxia, okay, and dysarthria. Mainly it will come with tremors. It will come with this tremors. Okay, this tremors. And as we saw in pediatrics part, this type of lithium intake in this during this pregnancy can cause this atrialization of ventricle. It is known as what? It is known as Epstein's anomaly. A good Dr. Mohammed Ansh. It is what it is. This Epstein's anomaly. It is the atrialization, lateralization of this ventricle. Okay, and we will produce this box-shaped hearts. Okay, and we need to know about this because this can lead to this toxicity. So we need to know and we need to monitor the drug. So it is one of the drug where we do this therapeutic dose monitoring. Will we do this therapeutic dose monitoring? Remember, fine. And next, if you see, what are the plasma concentration which we use? For example, for treatment of this acute attack of mania, we'll use 1 to 1.5 milliequivalent of concentration. Whereas for maintenance, it is around 0.8, which is 0.6 to 1.2. Whereas for toxicity, when we'll tell if it is more than 1.5. So remember, till treatment will use 1.5. If just more than 1.5, we'll tell them it is toxic. Okay, and if it is more than 3, it will cause permanent neurological damage. It will cause permanent neurological damage, and okay, and it may require dialysis. And if it is more than 4, it can lead to death. Okay, so what are the for what it is being treated? We can treat them for the acute episodes of mania, or we can prophylaxis also. We can use this lithium one, okay, and this bipolar disorder also will use lithium. We'll use bipolar disorder also, will use this lithium, okay, and remember about this Epstein's anomaly in a case of lithium, okay, and remember about this Epstein's anomaly, okay, and this can also even lead to this lithium induced diabetes insipidus, okay. Usually in a case of diabetes insipidus, we'll give amyloid as a treatment, whereas here usually will give thiazide diuretics as a treatment, whereas in the case of lithium-induced diabetes insipidus, we'll use amloride. Okay, remember, yeah, good approach. Next, we'll move on to this few toxicity and withdrawal symptoms. Yeah, it is means it is name itself. It is lithium-induced. Okay, it's mostly at the nephrogenic level. Okay, nephrogenic. Yeah, good approach. See, and next about this drugs like opioid and alcohol, we already seen in forensic medicine. So just I don't want to repeat them so that you will get these things same. So I added few more drugs. For example, you need to know about this cannabis. Cannabis we already saw, it is the Indian hemp which will be having this active compound which is known as tetrahydrocannabinol, and it is the most common illegally used drug. Okay, most common illegally used drug in India. Okay, most common illegally used drug in India. Good guys. Then this cannabis can lead to this synesthesia, means crossover of sensations. I can see the music. Okay, I can hear the camera. Okay, so like this will be there. So the two sensations which being having mixed, it is known as synesthesia. And sometimes this what will happen is this, they will tell this BT ho raha yaar, BT ho raha. So this bad trip will be usually seen in the case of cannabis. Okay, if like you plan to do these things to enjoy, but you returned with a horrible experience. Okay, and next you will able to see this one more phenomena which is known as flashback phenomena. Means what is this flashback phenomena? Okay, you or your friend, you abused cannabis 2 days back. Okay, they abused 2 days back, but now you feel this usage of this cannabis, or you will feel this euphoria without using the cannabis, because this cannabis they will go and store into this adipose tissue. It will go and store into this adipose tissue. Okay, so that's why it produces this phenomena which is known as flashback phenomena, and it will produce one more phenomena, one more thing which is known as run amok. This run amok means patient will be like this normal only, but because of this cannabis induced psychosis, he will go with rage and anger. He will do anything, like he will in Tamil Nadu happened one thing with this euphoria. He drove this bus from a bus stand to this police station. ठीक है ना, अगर बस चलाना है तो like road पे चला लो यार, क्यों police station के क्यों लेके आ जाना है. Okay, so he drove like this. So he did like some others, they will do this killing. Okay, they will make others to die also in this run amok phenomena. And so after this they will feel, yeah, I'm nothing, like I'm unable to remember this pharmacology, what I will do, how I will pass the examination. They will feel this amotivational. So all of these things, bad trip, flashback phenomena, run amok, and amultiple facial syndrome, all of this thing will be seen in a case of cannabis. Okay, cannabis. Okay, and about next one, which is known as phencyclidine, which is known as angel's dust. Angel's dust, just remember one thing, it will block NMDA receptor and it will be similar to schizophrenia. It will be, yeah. That is one more angel. Like that is not typical angel, it is sophisticated angel. That is angel mosquito, okay, which will be having the spots on their wings. It is angel dust, okay, na? There is star dust, okay. Likewise, it is angel dust, okay. Next, about this amphetamines. If you see about this amphetamines, like usually you need to know, it also mimics some or some kind of delusions, or it can even result into this formation of these delusions, okay. There will be presence of this paranoid delusions, like there will be a suspicion, okay, delusion of persecution, okay, the Othello syndrome, okay, and this auditory hallucinations even seen in a case of amphetamines use, okay, amphetamines use. Fine. Next, about this tobacco, it is the most common substance used in India before, like now there is some controversies, it will be more than alcohol. Will you are using tobacco more than alcohol? It is a recent studies, but okay, just have it, yeah. That is the jealousy, jealousy, it is Othello syndrome, good. And we know in a case of de-Clermont syndrome, also known as fantasy lover syndrome, okay, it is what? It is the delusion of love, pyar ki chakkar, okay. Then this is the tobacco one, Dilbag, Then about this tobacco, there will be withdrawal of this tobacco, means उसको तो सुट्टा चाहिए. So after 2 hours, he will be having this withdrawal symptoms. So उसके लिए हम nicotine replacement therapy or medication देंगे, or will give in the sense of gums, patches, inhalers and sprays. And medications में हम bupropion, sotopion वो हम दे सकते हैं, या clonidine, nortriptyline and varenicline. So 2 drugs you should know. One is this bupropion and varenicline. Okay, this also I have written in a separate one, because this anti-smoking drugs they ask in each and every examination. So don't forget. About OCD, you know, it is this recurrent thought like hath dhona, means you need to wash your hands. It will be producing this intrusive thoughts. So you will be having this recurrent intrusive thoughts, okay, or impulses. Or if you didn't do this hand washing, then you will be having this anxiety. So you will be having this anxiety. So it is known as what? It is known as obsession. Whereas compulsion, जैसे आपने हाथ धो लिया, when you wash the hands, you will have this sense of satisfactions, or this thing which you do to suppress it, okay. And you know it is you are not doing correct, ठीक है ना. जैसे आपका हाथ तो गंदा नहीं है, means your hand is clear, it is not contaminated, but you still these thoughts are coming and disturbing you. So you feel it is disturbing for you. It is ego dystonic. Yeah, good, Dr. Rituraj. Fine. Next, then it will be decreased by this compulsion. Okay, you will perform in response to this obsession. Fine. And symptoms, it should persist for 2 weeks to make a diagnosis. हमें पता है. For this, we can use SSRI as a treatment. Okay, and it can be associated with depression. ठीक है, ये मैं क्यों नहीं कर रहा हूँ? देखिए, why I am washing these hands for this much long. Fine. And for pharmacotherapy, you can use SSRI, and for psychotherapy, you can use cognitive behavioral therapy, like exposure and response prevention is the best modality, or else there will be this flooding will be there. Likewise, you can use. Okay, just remember, mainly this cognitive behavioral therapy, especially this export, you just make his hand ganda and you tell, don't wash for a while, see what happens. Nothing will happen. Likewise, you will expose and you will prevent his response. Okay. About this eating disorders, you should know. Eating disorders, there are different types, but you should know these 2 difference between this anorexia and bulimia nervosa. Anorexia nervosa mein, you see, there will be presence of weight loss, so the BMI will be decreased. Bas itna yaad rakho. There will be features of there is a female who is thinking she is motive, means she is fatter than usual. She is fatter than usual. So, but she is actually slim. Okay, she is fatter than usual. So, but she stopped eating things. And if she eats also, she tries to pour this out. So keep this thing separate. She stops eating. Because of stoppage of eating, then her BMI will be decreased, and this BMI may even result into this hormonal changes and amenorrhea as well. Okay, so this is a simple explanation of this anorexia nervosa. So there will be a female who is not eating, okay, or eating very less. Whereas in the case of bulimia nervosa, like means it is, imagine it is your friend's party, ठीक है ना, वो friend खर्चा कर रहा है, ठीक है, when your friend clears the NEETPG, or like for example you friend scored a good marks, okay, and you also pass the examination, तो वो क्या कर रहा है, friend तो party दे रहा है, party तो लेनी ही चाहिए, तो then you need to go, then you are going for the party, then अपने गर्दन तक खा लिया, means you have eaten till your root of the tongue, okay, you are the base of the tongue. Then after coming to your home, you realize actually it means I should not eat this much. Then you are putting your hands and you are vomiting. Okay, this is known as what? This is known as bulimia nervosa. लेकिन आप होटल से या KFC से इधर तक आ गए, means you came from KFC to your home. So in the meantime, there will be a digestion taking place. So few of the nutrition will be absorbed. So इसीलिए he will be having this weight loss. There will be no weight loss इनका होगा. Whereas in a case of anorexia, he won't eat itself. If you ask for party, he will go and take a piece of food and he will smell. हो गया आज का खत्म करके. Okay, so just remember these things. Fine. Okay, so this is these things like anorexia nervosa and bulimia nervosa. So mostly koncha Tamil solo kalapadu. Okay, so don't worry, like I will try to be in neutral one. So some explanations, fine. Then so this is the anorexia nervosa. The patient itself, he will not eat. Whereas in the case of bulimia nervosa, the patient eat, but he or she will purge or he will do vomiting and other methods to prevent her weight gain. But actually here the BMI will be normal. So this is the two differentiating feature you should think of. Okay, so first one, it is the anorexia nervosa and bulimia nervosa. In bulimia nervosa, the weight loss will not be there. Okay, will not be there. So in such cases, if you see, once the patient is putting hand and doing vomiting, then this teeth will come and cause damage to these knuckles. Someone cause damage to the knuckles. It is known as what? It is known as Russell sign. Okay, there will be a repetitive trauma, and after this repetitive trauma, what will happen? There will be, because of this scarring will be there. It is known as Russell sign. And to treat this, we'll use TCA or SSRIs. TCA or SSRIs. Fine. And next, we already saw the smoking cessation drugs. This one is this nicotine replacement therapy, as chewing gums or Lorentz, or we can use these drugs which include bupropion, varenicline, and bupropion and varenicline, and bupropion is it can be used as an anti-anxiety as well. Fine. Whereas varenicline, it is the most effective anti-smoking drugs. It is the most effective anti-smoking drugs. Okay. And about these three things, which is this postpartum blues, depression, and psychosis. Remember this BPD. Okay. Blues, psychosis, and depression. Okay. Depression, it is the worst part. See, it will happen around 3 days. Okay. Yeah. Psychosis, it will be for 3 weeks. Whereas depression, it will happen after 3 months. Okay. Between 3 months. See, blues मतलब कुछ नहीं, ठीक है, बस रोती रहेगी. Means the female will be crying, nothing. Like she will feel very low at this moment. Okay, that's it. Okay, there is this emotional ability and sadness and tearfulness will be there, and she will be having the sleep disturbance. That is blues. ठीक है, that is the blues. Like she will be having the low mood. ठीक है, खाने का मन नहीं कर रहा. Okay, then she is unable to eat. So then she will be having the feeling of to cry. Okay, and there will be sleep disturbance. This is the blues. Whereas in the case of postpartum psychosis, okay, there will be what? There will be the tendency to harm the baby. Okay, na? He means there will be psychotic will be there, and the psychosis means he want to kill the baby because someone has stole his baby. Someone has stole his baby like a hallucination. They will someone stolen his baby in the womb, like that. He will be having the hallucination. That is the postpartum psychosis. It will be happening around 3 weeks. Okay, whereas in the case of postpartum depression, she will tell like, no, it is not the child, it is not the child I have given, it is replaced. So she will go into the depression and thought of suiciding herself and also suiciding or causing damage to the body. So she also will die, thinking to die, and she also harm the baby. So it is the postpartum depression. So इसीलिए so we'll give a drug in a case of postpartum depression, and along with this psychotherapy we'll do for this all 3 ones. तो इसके लिए हम क्या करेंगे? We'll give this psychotherapy as well as we'll give this drug which is known as brexanolone. It is known as brexanolone. It is known as brexanolone, which we use in a case of postpartum depression. Okay? These are the things you need to know about this postpartum changes. Fine. And next about this disorders which is known as generalized anxiety disorders and other anxiety disorders and PTSD. In a case of generalized anxiety disorders, one of them is what? This first one, it is the panic disorder. Panic disorder means there is a sense of impending doom. So everything is going to stop now. The world is going to break now. So they will be having this feel. Okay, they will be having this feel now. Okay, fine. The onset of palpitations, choking sensations, and dizziness, and everything. The world is going to end, and I am going to die. So this feeling will be mentioned in the questions, and this may mimic this myocardial infarction. Okay, myocardial infarction. So it is the typical feature of this panic disorder will be mentioned. Yeah, there is a feature of impending doom. Next one, there is this generalized anxiety disorder. There will be in a sense of relentless, like there will be floating anxiety. Okay, hey, karle to nahi hoga. Means what will happen if I didn't do this? If I didn't do this topic, what will happen? I should solve from Telegram. I should problem this app, that app. So you'll be having this free flowing anxiety. तो इसके लिए हम क्या करेंगे? We'll use benzodiazepines to calm her, okay, and SSRIs and CBTs. इतना याद रखो, ठीक है? Then about post-traumatic stress disorder, it will be usually following a traumatic event, for example, any accident or any war events. So it will be happen mostly after more than it will be happen more than 1 month, and it should be, if it is present after or more than 1 month, it will call them as PTSD. If it is less than 1 month, we'll call them as acute stress disorder. Acute stress disorder. Fine. For treatment, we'll use SSRIs and cognitive behavioral therapy, and we'll use one more method which is known as eye movement desensitization and repression, EMDR. EMDR in the case of PTSD. Okay, EMDR will tell them to imagine and will tell them to eye movement. Okay, and by this the anxiety level will reduce. Okay, they won't go back to the place where this event or this war has happened, where this car accident has happened. They'll be having this intrusive thoughts. This again, this gonna happens. Okay, or they'll be having this, once they hear the sound of car, they will think the accident gonna happen, like that. Okay, so this is the post-traumatic stress disorder. Fine. And the final part of the psychiatry means, yeah, it is the child psychiatry. If you see about this child psychiatry, it is what? It is a, there are different diseases. One is this ADHD, which is this hyperkinetic disorder. And in case of hyperkinetic disorder, the main, it is what? It is pharmacological. We can use two drugs. One is the stimulant and non-stimulant. Stimulant ke liye will use methylphenidate, whereas non-stimulant will use atomoxetine. Means, for example, if the child, it is a small child, like 10, 12 years, but now if you see some part of India, in some schools there will be abusings of this drugs will be there, for example, cocaine abusing or alcoholic abuse. So in such abusers, we won't give methylphenidate. So in the case of those abusers, will give non-stimulant drugs like atomoxetine, atomoxetine will give them. Fine. And okay, just remember. And we also do give them social, psychosocial interventions, and will give some social skill training for them. Okay, and how to behave in environment in the case of ADHD, which is a hyperkinetic disorder. Okay, and there are few more diseases you should know. One is this autism, Rett syndrome, HELLES syndrome, Asperger syndrome, and learning disability. See, autism, there will be what? There will be poor imagination, there will be a low IQ, okay, and there will be a language deficits, and along with this behavior also will be affected. And the main thing here, it is the social interaction. Social interactions will be there, and sometimes like there will be IQ defected, sometimes there will be over IQ developed. Okay, this is the features of autism. Whereas Rett syndrome, it is typically seen in females where there is a regression of this, brain growth and causing this microcephaly. There will be microcephaly and regression of this brain growth. So it is due to a mutation which is known as MECP2 gene mutation. MECP2 gene mutation, which is seen in a case of Rett syndrome. There will be features of autism along with these features of microcephaly and brain or growth retardation changes, especially seen in females. इसको treat करने के लिए we have invented drug which is known as trofinetide, which is used in the case of Rett syndrome. In HELLES syndrome, क्या? It is seen especially mostly in males, and it is this decrease in acquired skills. ठीक है ना? जैसे जो भी acquired skills, for example, writing, scribbling, okay, making cubes. This acquired skill will be lost in this child, and along with this, there will be a loss of control of bowel and bladder movements. There will be a loss of control of bowel and bladder movements will be seen in a case of HELLES syndrome. Remember, hell. What is the hell? The hell is here is that there will be a bowel and bladder involvement. Okay, and in a case of Asperger syndrome, it is autism minus means social interaction. So there will be just social interactions will be affected in a case of Asperger syndrome. In a case of learning disability, everything will be normal, but his exam scorecard will be abnormal. Okay, everything will be normal except his exam scorecard. Okay, that is this learning disability. Yeah, next the final one, the psychology one, psychiatry one. It is this psychosexual stages. Oral stage, it will be from 0 to 1.5 years. Anal stage, it is from 1.5 to 3 years. Remember, if there is any fixation at this anal stage, it will result into this OCD. Fixation of this anal stage results in OCD. Whereas phallic stage, there will be two things: Oedipus complex, electra complex. This Oedipus complex and electra complex fixation. Okay, this Oedipus complex and electra complex fixation at the level of phallic stage, which is from 3 to 5 years, it leads to this hysteria. Will cause hysteria. Okay, hysteria. Good. Fine. Next one, yeah. Next one, there is this later stage which is from 5 to 12 years. Okay. Then here he will be able to focus mainly on this learning and gaining skills. Whereas on E, he will be knowing about the sexual and adulthood things. Okay. Maturation of genital function. So it will be around 12 years. So remember about this mainly, yes. Oral stage 0 to 15, 0 to 1.5, anal 1.5 to 3, and phallic it is 3 to 5 years, and latent stage it is 5 to 12, and general stage it is 12 years. Fine. And remember, anal stage fixation causes OCD, whereas phallic stage fixation causes hysteria. Okay. So this is all about this psychiatry, or the most important point the psychiatry you should know. And also remember about this hallucinations, okay, or and about this delusions, especially like delusion of love, which is known as erotomania. Erotomania, like yeah, auto driver, he is a lover of it is known as love, which is known as erotomania. And delusion of pathological doubt, okay, which is known as what? Infidelity, also known as Othello syndrome, okay, Othello syndrome, okay, and there is this just remember about this delusion of reference, means everything happens because of me, okay, and reference means referring him, okay, referring him, like the world is circling because of me, circling or rotating because of me, okay. And enormity, if I sneeze, I will blow Delhi, okay. So I will sneeze very calmly, okay. So these are the delusions: delusion of love, delusion of infidelity, and delusion of this reference, and delusion of enormity. So just remember about this, all these delusions for part, okay. Yeah, about this phallic state, just remember there are two things, like female feels there is this penis, which is an extra organ which is not present in her, so she have a adaptation, or she has a love towards his father, okay. This is known as what? This is known as Oedipus complex. Whereas male, it will be having attachment to the female, it is known as Electra complex, okay. The two complex you should know, Oedipus complex and Electra complex. And if there is any fixation, like if there is any fixation at this stage, it happens, it leads to this hysteria, okay, or any other type of neurotic illness, okay. Just remember this thing, okay. It is not these are fixation stages, means like at this stage if it fixed, it will lead to hysteria, okay. Their mind will be very much new, kind of simple, okay. Yeah, that's it guys, that's it about psychiatry.